cases that we're involved in where there's been a delay in diagnosis of cancer usually involve someone having had repeated trips to the GP, for example, and or the hospital concerned about an aspect of their health.
Perhaps they've been going to their GP surgery on a number of occasions with a complaint, and it's taken several months or longer for a cancer diagnosis to be reached.
Often the delay lies with your primary caregiver, that's often your GP or your GP surgery practice nurse.
If a doctor suspects that there could be an underlying diagnosis of cancer, then they need to refer that patient immediately to hospital for further tests and investigations.
If there's any delay in either the referral to the hospital for that, or indeed the hospital actually carrying out that investigation, that can lose you vital weeks in getting the diagnosis and therefore treatment that you need.
In some cases, even the shortest of delays can make a difference to the outcome for the patient.
The circumstances of how that delay has occurred needs to be considered and who might be responsible for it. It might be the doctor making the referral, or it might be the doctor receiving the referral who hasn't acted quickly enough.
We do get an awful lot of inquiries, and we've had an awful lot of cases involving delayed diagnosis and misdiagnosis of cancer.
Cancer can affect any area in the body, from the skin to all of the internal organs, so it's an incredibly broad subject, both in terms of medicine and in terms of law.
If a patient has sufficient signs and symptoms that could be associated with cancer, then GP should refer on what we call a 2-week wait referral, so an urgent referral to the relevant expertise at the hospital. Often we find that patients present with signs and symptoms that could be suggestive of cancer that aren't sent on that 2-week wait referral, and that's often when the delays can occur.
With certain cancers, the earlier you can get in there with the diagnosis and start that treatment, the more gentle almost that treatment can be for somebody. In terms of the worst case scenario, unfortunately, obviously a delay in diagnosis can mean that that treatment is just started too late. And so when the treatment does start, it's for what the medical world call palliative or end-of-life care only. So it's not treatment that's going to help cure somebody of the cancer, it's just going to give them a few extra months.
One of the things which we understand at British McFarland is difficult for people is when they are battling a condition as serious as cancer, the last thing they want to do is think about legal proceedings as well. In that situation, they can always appoint a friend, loved one, family member to represent their interests, and we can deal with that person on their behalf.
We are very down to earth, very easy to talk to, very approachable, and I think for the type of work we're doing, that's very important.